between the Ministry of Health and so forth, because it is going to create a serious, serious problem.
Yes, member, we have been looking at adjusting the rates. So yes, the rates will be adjusted for the persons in the critical areas, for the trucking rates, both for what we sell and what our private truckers will deliver on our behalf, because we understand that challenge. The new rates are not yet published, but for this period, the rates will be reconsidered. As it relates to the shelters,
because we are in this critical period right now, how early those announcements will be made that at least the $2 million that was allocated to Northwest Clarendon, the 3 trucks that they asked us to identify, the 3 trucks turned it down because of the rate.
The new rates will be settled by this weekend.
Follow. Sorry, I don't know if I missed this part. Minister Robinson was distracting me. Member, the new rates will be published this week, and you're confident, Dr. Campbell Francis, that these new rates will be satisfactory to market to the truckers?
I will not be able to say that. I cannot say. Yes.
Okay. Would you be able to say the level of increase? 5%,
no, not yet.
2%? Not yet. So,
but we will announce the increase by the weekend.
Okay. Member Azan has asked me to ask you about payment, because he's saying that the contractors are saying that sometimes, we know the processes. It just wondering if they've been more efficient with the payment of these contractors.
Part of that situation, member, is something that we'll be looking at in the nearest future where procurement is concerned, because I take it that it has a lot to do with procurement and payments. So we'll be looking at that further from now.
Thank you, Mr. Chairman. So water and the physical infrastructure of it as we see it, I made the point, we realize that in deep rural areas of Westmoreland, Hanover, St. James, St. Elizabeth at this time, your customers or who you serve is far less than 25%. Do you have any numbers, any thought process you could share with us as we try to grapple with what we have not come to terms with a full understanding this morning, what we have failed on? You have put us in the right direction. You have placed clearly in front of our eyes what we need to look at as committee members, and we will be going there. But do you have any thought process? Because I'm sure you have done your studies of areas such as Cedar Valley, Trinityville, which are very similar in many ways to St. James, South St. James, the hills of Hanover, St. Elizabeth, because it's very important for us to understand our strength and weaknesses as a country.
Those numbers, member, would be contained in the section that says customers not yet restored. So the actual numbers of customers are there for each parish. Yes. Total number of people in the population. Okay. We will attempt to provide that in the presentation that will come.
The question that, Madam, the question that you just asked, member, is not on record because it did not go through. So ask it. Hold on.
The question we're putting forward, you're familiar with it. The requirement, customer requirement, community by community, parish council division by parish council division. I go there because a lot of these systems that we are now going to be looking at when we go deep rural are parish council systems. and rural water. So we are going to have to go somewhere else to get the numbers in terms of to understand what the requirement is, what the shortfall is, how many citizens we have now in these different areas and in these different parishes that are not being properly served with treated water. That is what we're trying to get at and to see what we can do in the near future. And I thank you for your time on this.
Yes, member. In terms of the service of water overall, as you're aware, under the National Water Sector Policy that is currently in effect since the last revised version was 2019, 85% of the population is supposed to be served by the National Water Commission, and the other 15% via the parish councils, private providers. And as you're aware, Rural Water Supply Limited works with both the NWC and the NWC and the private providers, as well as parish councils, to develop systems as we go along to provide water in rural and urban areas. But in terms of the policy, we are classifying areas to be served as not rural and urban, but we are looking at the areas as non-utility service areas and utility service areas. So NWC would be responsible for providing water to the utility service areas, and these are areas where it is the least cost method to provide piped water. While for the other 15%, which falls under the non-utility service areas, those are areas where it is really difficult to have piped water from the NWC. So that is where you would have a lot of cases with the parish councils having these small supply systems, and they would have barbecues and those sort of things where they would provide catchment tanks, so they would provide water to the various communities. So it's a combined effort in the water sector between the private, the government, through the NWC and the Rural Water Supply and the parish councils to provide water as best as possible. So the vision is to provide it as best as possible up to at least 2030 to have at least the majority of, or at least 100% access, but given circumstances and things that happen, it may not meet the target, but as best as possible to meet those targets. And in fact, right now, this hurricane has kind of impacted some of the progress that is being made. But the efforts are there to ensure that we get back to where we were and get back on track to provide universal access, at least by 2030, to various programs being managed by the ministry and the agencies. Thank you.
Thank you. At this time, when you speak about the National Water Policy 2019, that's what you had indicated, that's where we'll have to go and read. So, Mr. Chairman, through your chair, can we get this, and so we can have a good look at it, this policy paper. At this time, what percentage of St. James would be with treated water? What percentage of Westmoreland? What percentage? Would you have an idea of what we're faced, what we're looking at this time? Because you explained quite well earlier that even though you have back online some of your major water supply systems, because they are not running on the JPS system, they're running some of them on generators, their output is maybe at 59%. I recall that figure, I noted it. Do you have a thought process on that? What we face, what the challenges are there in terms of what percentage of different communities or parishes that are receiving treated water?
Delano, could you share this?
Welcome to Alteryx One, a self-service analytics platform that makes it easy to automate analytics at scale and enable better decisions across all of your critical business functions. Prep and blend your data, build robust machine learning models, and let our AI engine discover and explain new insights faster, all directly through your web browser. The best part? Alteryx meets you where you are, whether on-prem or in the cloud, with support for all major cloud hosting platforms, coupled with local regional hosting across all major regions. Integrations with a wide variety of data connectors allow you to access all of your data anytime, anywhere. And regardless of your environment, Alteryx provides enterprise-grade scalability and security. See for yourself today.
Persons in this space. At 50% restoration, about 85 to 90,000 customers have access to water as at this morning based on the larger systems that we have now brought back online. We do note the concerns that there are still elevated areas that have not yet started to receive pumping, but along the plains where water is flowing directly from the pumps or via gravity, that's our estimation at this point.
Sir Chairman, may I just add a little to Mr. Delano's answer, as well to indicate part of the challenge we have at the National Water Commission, especially in a restoration situation like this, is many of the systems will take some significant time to be fully charged. So a Great River water supply system that came back into operation, all of the customers on that system would not immediately begin to see the restoration. So a customer who is connected to that particular system may hear that the system is back, and it's gonna take, in some instances, a day, 2, or even more for the system to become fully charged so that they will see it in their pipes. The problem is also compounded that, especially now, when the areas have been without water for an extended time, so everybody's tank is empty and everybody is filling. We also know that there are a number of breaks, either at the individual customer home or that are on the network. So we want to encourage persons to continue to bear with us as we work feverishly to restore their supply. But when the system comes back, it does take a while for all the customers to begin to benefit from that. But the good thing is that with the system now in place and operating, it is going to bring more and more persons with service, reduce the areas in need of trucking, and also reduce the areas from which persons need to come and collect water. So each day we hope to be making further progress and to be making more customers come on board. I also may need to add some things to an earlier question with regards to our communication, because we recognize that even in those instances where we are issuing communication, it may not at this time be reaching all the customers. So we're posting on all the social media. We have the NWC's WhatsApp line that is up. We have a mobile app that is providing information. We have our contact center, which is taking toll-free calls on a daily basis. But we do acknowledge that, especially in this circumstance where communication is not free-flowing, there may be persons who are still out there despite our communicating. I commit that we will always work at communicating more and better, but part of the challenge is also that the message is being sent, but there's no one in a position to hear the message. I hope I've added something to that.
Yes, Chairman. So Buchanan, the suggestion I made to send the information to the political representative, you will take that on, that you will share that information daily, because you go into an area and persons say that they can't get water, what is the problem? The member of parliament or the councillor could easily well access to say that this is the information that we have.
Yes, we will be committed to working with all the critical stakeholders to help spread the word in as many channels as we possibly can. And our community relations teams will activate even more than before.
To Dr. Francis, she didn't answer about the shelters thing, but I want to ask before. I see you have 51% in Manchester Restore and 71.5 in Clarendon. But Moravia, 2 meeting, Peace River. Moravia, all right, Manchester 51 and Clarendon 71.5. I know that Moravia is served by Manchester. 2 meeting, Manchester 2, or Clarendon. Both of them. And the Peace River. There's any time period, especially for the Moravia and the 2 meeting who serve the hospital at Spalding. What is the plan for that?
Let me start with the shelters question first. So we have been having discussions, or we are in dialogue with the Ministry of Health. So as it relates to the shelters, the only shelter that we were asked to come in to provide some assistance was Petersfield in Westmoreland. So we have been trucking, and we have also assisted with doing some assessments to provide some additional storage for them, because their issue was a storage issue. So until then, the trucks will have to go to them daily, which is happening. As it relates to Moravia, it is on our critical listing. So what I asked is that our teams had a generators listing, critical generators that we needed, that did not include some facilities that were in the hardest hit area. So we have, since Melisa, updated our facilities listings, and the critical facilities for us are those in St. Elizabeth, in the parishes in the west. So we have shifted our critical listings to include the parishes worst hit, because we are working hard to improve the numbers for those parishes. If you may allow me to answer a question that was asked before, and that is the matter of the facilities not yet assessed. You're right, you got content, and I confirmed Retrieve. These are for Hanover, Westmoreland now, Retrieve, Jerusalem Mountain, Greenwich, and Dantrout, but they have committed to completing those within the next 2 days. So by the weekend, content, we don't know what the flooding situation will look like, but the other 4 will be done this weekend. Yes. Content St. Elizabeth, that's the one that's flooded. Oh.
In a boat that the truck, the filling station is in Porous, and they have to travel all the way up to Winston Jones now to head back to Christiana and Spalding, because content is flooded.
So they would have done the assessments. What we are referring to those that we have not been able to look at all, which would be these 5: the content St. Elizabeth, then Dantrout, Greenwich, Jerusalem Mountain, and Retrieve. But we will have those 4 completed on or before the weekend.
Members, we are now 29 minutes to 2 p.m. I'm going to be taking the last question.
Doctor, repeatedly saying the weekend.
Sound like a song.
For the record, I want dates. I want details. I want dates. So the weekend, let's get dates.
Weekend starts Friday.
Right. So the weekend, today's Wednesday the 12th. So the weekend, what do you
Remember,
say?
you asked for the date.
Right. I'm sorry, Chairman.
Right.
Dates, please.
Can we now have
for the
a
record.
date for the record, Doc?
Okay, so the Friday is the 14th. So by the 16th. Yes.
All right. Once again, let me say thank you to the team from NWC. You have been very insightful, even though we're still at a point not comfortable. We appreciate the information that you have brought to us this morning. I take it that John Public, especially in the western part of Jamaica, will find it favorable to appreciate what you have said, but at the same time, the concern is very high. And so we will continue to be in dialogue with you, whether we will ask you just to send us a report or we will call you to come back to us to present on the situation, hence from here until that time. It is a never-ending work. We continue to do the work. You on your side, us on our side, but we must at all times work together hand in hand to make the lives of Jamaica citizenry comfortable as best as possible. Once again, we say thank you, and we look forward to the workings. At this time, Dr. Campbell, Ms. Talia, and your team, gentlemen, you are excused. You don't have the mic, member? The meeting is not over. Whilst the members from the NWC team is making their excuse, are there any other business? None. A date to be set next week, the 19th, tentatively, but if there is no other meeting on Tuesday the 18th, then we'll have the meeting brought forward to that time. At that time, we hope that the other agencies, NWA, NROC, NSWMA, National Solid Waste Team, those entities will be here. We are also looking forward to have the different parish MCs in the West to be here to give us an update, because they too are doing some amount of work. They have some amount of responsibility, just the same. All right? But remember now, member Azan, not all entities will be here all at once. So we will send to you those that are confirmed for next week, Tuesday/Wednesday.
Could the minutes be sent like the day before that you can able to look
as soon as it is prepared, which will likely be at least a day before.
Okay.
If it is sooner, you'll get it.
Okay.
I just want to emphasize again, at some point, Mr. Chairman, we would like to meet with the procuring department of the Ministry of Finance, because we want to understand if they have any thought process that will help us in this immediate emergency that is time sensitive.
Noted.